the backboard, the spine board. It's been the standard of care for a long time. But the fact of the matter is people aren't flat. And strapping an injured person to a hard, flat board is doing more harm than good. I want to introduce you to a product that solves that problem and gives superior head-to-toe stabilization while maintaining patient comfort. I'm Chief Rob Wylie. This is the Innovation Zone. Let's face it, our patients are not flat, and putting them on a hard, flat spine board just adds insult to injury. We want our patients comfortable. It gives them a better outcome. Hartwell Medical has come up with a FASPLINT full-body splint. This new technology allows the splint to form by a vacuum process around the patient to make it more comfortable for them and to also achieve the immobilization that we want for that patient. The beauty about the FASPLINT is that you can maneuver this thing in any way you want to make it more comfortable for the patient. The polystyrene beads are easy to move around. You can shift them up under the knees, into the low back, up under the neck if that's more comfortable for your patient. And you may look at this thing and say, well, how long does this thing take to set up? Once you get the beads where you want them, you attach the pump, you draw the air out, in less than 20 seconds, you've got a form-fitting vacuum splint that provides comfort and stabilization for your patient from head to toe. It's a great system. The size, it folds up fairly small. We all know that space is a big issue on any ambulance, any fire truck. It folds up into a nice little case so you have lots of extra room for your other equipment that you have to have. It doesn't take up a lot of room, which is a big plus for all of us. We know that. The thing I like the best about this thing though is it fits the patient. Instead of trying to make a patient fit a hard, stiff backboard, the FASPLINT allows you to mold the immobilization device to your patient. It's an innovative, creative, and very effective tool that I think really is going to make a difference in patient care for all of us. I know a few of you are out there thinking, what happens if this gets punctured in the field? It's a vacuum device. Well, fact of the matter is, it's very easy to fix in the field. A little bit of duct tape, any non-porous tape, like an EKG pad. Take care of it right then and there. It comes with a vinyl repair kit, so when you get back to the station and have a little more time, you can fix it up right, it's good as new. We talked about the fact that space is always an issue on fire trucks and ambulances. And if you're just really tight for space, FASPLINT's got the answer for that too. This is the halfback. It's got all the advantages of the full body splint, but now you've got good stabilization from hip to head. It's a very tough, very durable piece that'll give you that same comfort for the patient and that same stabilization that we want. The other feature that both the halfback and the full body splint feature is this stiffening element. Not only does this help make a one-body head-to-toe stabilization platform for the patient, but it also keeps the device from shrinking longitudinally as you take the air out of it, so it keeps its form. Very important feature that makes this unique. The versatility of the halfback is another really cool feature. Some groups are even using this as a pediatric immobilizer. Like most things, you put it in the hands of a paramedic or a firefighter, they'll find 15 ways to use this thing that you've never even thought of. It's that versatile, and I think that the way it works is very, very intuitive. So the patient not only is going to be comfortable, but the rescuers are going to find new ways to use this to aid their patients every time they take it out. Here at the Innovation Zone, we try to keep our eyes open for the next big thing. This is the next big thing. It's unmatched in the ability to provide not only positional comfort for the patient, but head-to-toe immobilization. It doesn't take up much room, it's not very expensive, and it's an outstanding adjunct to the traditional spine board. Your patients are going to be happier, and if their patients are happier, you're going to be happier. This has been the Innovation Zone. I'm Chief Rob Wylie. Thanks for watching, and be safe.